Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on the Do Health trial, published in Nature Aging. The lead author is Dr. Heike Bischoff-Ferrari. She's professor at the University of Zurich. And the last author is Steve Horvath, who is in line to get, I think, the Nobel Prize for developing the epigenetic clocks. The Do Health trial study overview. Objective: it investigated the effects of omega-3, vitamin D, and exercise on biological aging. It was a multi-center randomized trial with 777 participants aged above the age of 70 from 5 European countries. Interventions: daily 1 gram of omega-3, 2000 international units of vitamin D, and 30 minutes of exercise 3 times a week. Outcome measures: DNA methylation based biological aging markers. Key findings: omega-3 alone slowed biological aging by 2.9 to 3.8 months over 3 years. Combined effects: omega-3, vitamin D, and exercise together further reduce biological aging. Health benefits: a 10% reduction in falls, a 13% reduction in infections, a 39% reduction in prefrailty, and a 61% lower risk of invasive cancer. Implications and conclusion: omega-3 and vitamin D influence DNA methylation and biological age. Clinical impact: small. Potential preventive strategy for aging-related diseases. Future directions: further studies are needed to determine long-term effects on lifespan and health span. What about fish oil? I'm a little concerned about this study because previous data has shown that fish oil actually makes LDL cholesterol worse. A Cochrane review of 23 randomized clinical trials found that fish oil increased LDL cholesterol or bad cholesterol. In the Journal of Clinical Endocrinology and Metabolism, high-dose docosahexaenoic acid from fish oil also increased LDL cholesterol. The key takeaways from these studies: it reduces triglycerides but may raise bad cholesterol. In addition, there is a meta-analysis of 7 randomized trials which showed an increased risk of atrial fibrillation with omega-3 greater than 1 gram per day dose. Serous-Sinai systematic review and meta-analysis showed a 49% increased risk of atrial fibrillation with high-dose omega-3. There was a JACC study which showed no significant AFib risk with the dietary omega-3. Key takeaway: high-dose supplementation may increase your risk of atrial fibrillation. It's interesting, in an accompanying news article in Nature, clinical scientist Professor Heike Bischoff-Ferrari and geroscientist Steve Horvath say they take omega-3 and vitamin D supplements every day to prevent aging-related health issues. I do this every morning with my coffee, says Horvath. I practice what we publish. I'd like to remind the readers and listeners, Linus Pauling, a Nobel Prize winning chemist, was a prominent advocate for use of vitamin C. He believed that a high dose of vitamin C could prevent and treat a variety of diseases, including common cold, cancer, and heart disease. He lived till the age of 92. Dr. Louis Ignarro, who won the Nobel Prize in Medicine in 1998 for his research on nitric oxide, developed a dietary supplement called Nightworks, which is designed to increase body's production of nitric oxide. David Sinclair who's a genetics professor at Harvard Medical School who studies aging, himself takes a regimen of resveratrol, nicotinamide, vitamin D3, and other supplements. He also believes in caloric restriction. So go figure, the Nobel Prize winners have their own supplements which they advocate for. Leave a comment on what is your supplement.